This was a 9-year-old child who was in a severe motor vehicle accident. If one looks at the brain windows, one can see that there is hemorrhage that is located in the posterior fossa. Hematomas in the posterior fossa are unique because of the confined space of the infratentorial compartment, and therefore the indications for surgery are different for a hemorrhage that occurs in the posterior fossa as opposed to the supratentorial space. In this case, although it seems like there's not that much hemorrhage associated with the injury that we will describe, you can see that the fourth ventricle is not well visualized in this individual. Not only that, but there is hemorrhage both on the right and the left sides of the cerebellar hemispheres. You also note that the patient has extensive air in the soft tissues of the scalp posteriorly, and that scalp swelling is present both on the right side and the left side. All this becomes a little bit more clear when one looks at the bone windows. In the bone windows, one can see that the patient has a comminuted fracture of the occipital bone both on the right side as well as on the left side, in this case actually crossing the mastoid air cells on the left side, and with extensive involvement of the temporal bone as well, here affecting the middle ear cavity. You notice that there is air in the soft tissues along the left temporal region because of the communication with the aerated mastoid air cells from the temporal bone. In this situation, once again, it is a dramatic event to have a posterior fossa hemorrhage, and this patient will be serially scanned quite rapidly in order to determine whether or not the patient is herniating. When one has hemorrhage in the posterior fossa, the cerebellar tonsils may descend through the foramen magnum, and if they do so, you may have compression of the important portions of the brainstem, including the medulla, which direct respiration as well as cardiovascular function. And this is a potential source of a patient's rapid demise from cerebellar hematoma with tonsillar herniation.